Good morning, everyone. We're back here at Glen Smiles Dental Clinic in Glen Waverley with Dr. Sachin Gamage. Today we're talking about a dental issue that widely affects a lot of people, discoloration of teeth. So Dr. Gamage, first of all, thank you for joining us today.
Yeah, thank you for having me here again.
So Dr. Gamage, my first question is about why do people lose their natural whiteness in their teeth?
Yeah, I think there are a few different reasons. It can be either extrinsic or intrinsic staining. So extrinsic is on the surface. It's similar to how like towels can get dirty over time. So that extrinsic staining can be scrubbed off, sometimes by the patient, but some of this staining is quite stubborn. So there are some special techniques that we need to use cleaning wise when you come in for a clean that we can usually get the staining off. So that would mean the extrinsic staining, but over time the tooth itself can get darker. Like so, coffee, tea, even like red wine, those sort of stuff can lead to intrinsic staining that's actually incorporated within the tooth. So that can be also treated with whitening and other sort of systems. In addition to that, there are some medications or like antibiotics that were taken long time ago. We're still taken, but not given to kids as much because we know about the tooth whitening risk. One is tetracycline staining that was quite common in the older population. It leads to a type of staining that is a little hard to treat, but there are still ways to treat that. Other things would be tooth wear can lead to darkening because what happens is when the enamel gets worn out, the tooth does appear darker, and other age-related changes as well can lead to the teeth getting darker, which again hard to treat, but there are solutions to that as well. Some dental procedures like having root canals can also make the teeth darker, and that can be treated with internal whitening and different systems as well. So there are a lot of different solutions for dark teeth.
Right, now we've talked about the causes, but what are some preventative measures that people can take to ensure that they don't fall into the bigger problem where their teeth are discolored and they have to go to a bigger extent of putting in more effort to get them cleaned?
Yeah, I think one would be having regular cleaning, like the cleaning that you do at home. So good oral hygiene. That's a good starting point to especially prevent that extrinsic staining that can build up in between the teeth. Other things would be potentially like limiting staining sort of products like black coffee and tea a little bit. Sometimes using like a takeaway cup can limit how much exposure there is to the teeth. Mm-hmm. So those sort of things can help. I think like another important point would be tooth wear. So reducing acidic sort of products, because once the enamel actually that's on the outside of the tooth help the tooth appear whiter. So once you get rid of that enamel layer, the tooth does get darker inside.
I see. Now you talked about oral hygiene, Dr. Gamage. Can you explain to us and our viewers at home, what exactly does good oral hygiene look like?
Yeah, I think good oral hygiene requires brushing twice a day for about 2 minutes morning and night, and ideally flossing at nighttime or using something to clean in between the teeth. So that's the main thing. And one common thing is people miss certain parts of their teeth. So certain parts of their mouth, they don't brush as well as other areas. And it's quite important that you get everywhere, all around the tooth, close to the gum line as well, because a lot of plaque and things build up close to the gum line. So proper technique, brushing twice a day, morning and night, and flossing in between is what's important.
Right. Now my final question for you today, Dr. Gamage, is are there some stains that are more difficult to clean than others?
Yeah, so there are some stains that are difficult to treat. So one will be that tetracycline staining that affects some people. That's quite a difficult stain. Another difficult stain is sometimes after a root canal, like some of the materials that were used in the older root canals are hard to treat, but there are still ways to do that. So sometimes if we can't treat it, so we try to be minimally invasive. We use sort of whitening products and things to whiten the teeth. But worst case, if it can't be clean, we can cover the outside with sometimes filling material or porcelain material. So what's known as porcelain veneers are quite common to treat discolored teeth as well. But that doesn't, that comes down the end of the treatment after we've tried other things.
Right. Now, I know I did say it was my final question, but I do have a follow-up question for you today. It's centered around whitening products. Now, in the market, there's so many new whitening products coming into play. What are your thoughts about them? Do you recommend them, or do you recommend purely just good oral hygiene through like technique and frequency?
Yeah, I think that probably the best thing is to have a diagnosis as to why the teeth are dark, because every type of staining requires a different treatment. So like extrinsic staining doesn't actually help with those over-the-counter whitening. So it's more to do with the cleaning aspect. Intrinsic staining, that's quite common. There's no harm in necessarily trying some of the over-the-counter products, especially if they're sold in Australia, because they go through good guidelines and like testing and things. So they're quite safe to use. But I think it's always good to go in to see your dentist and see why they're dark, and they can advise you what to use. So there are whitening products that the dentist can prescribe that are not over the counter, that's specific to you. And that does require the dentist to prescribe, because like sometimes some of those whitening products are quite stronger in concentration. They're not recommended for certain ages and certain conditions if you have sensitive teeth and things. So I think the main thing is get a diagnosis as to why they're dark, and then we can go through what can be done.
Amazing. Well, thank you so much for sharing your insights again with us, Dr. Gamage. That brings us to the end of our segment today.
Okay, thank you for having me here.
See you again next week at Glen Smiles Dental Clinic in Glen Waverley as we discuss all things to do with your pearly whites.